So the people can still be severely infected. And with the number of cases that we have being so high, even a very small percentage of that number, if even a very small percentage of that number requires hospitalization, that's going to place a significant strain on our already overburdened healthcare system. So we continue to encourage testing, we continue to encourage vaccination. But as I said yesterday at Churchill Downs, if you have mild symptoms or if you're getting tested and you're asymptomatic, needing testing for work or school or other guidance, it is super important that you get that testing at an independent site like the one at Churchill Downs or others where you are not taking up space in an emergency room or urgent care or even your doctor's office. So we're trying to encourage people to stay away from healthcare if they don't need healthcare. Certainly, if you do need medical attention, please seek it. But if you're getting tested and you don't need to see the provider, get that test outside of the healthcare systems. I'm going to stop sharing there and go back to you, Dr. Moyer.
Thanks, Dr. Hartledge. So I know we're getting a lot of great news with booster being expanded and also some news about 5 to 11-year-olds getting a third dose. Do you mind going over that again on who qualifies and who should be signing up for another vaccine dose this week?
Absolutely. The good news is that the guidance is relatively simple compared to what we've seen in the past. So at this moment, everyone age 5 and up is eligible for a vaccine series. That's the traditional 2 doses. The mRNA doses are the preferred product, that Pfizer or Moderna, and only Pfizer is approved for those under 18, so 5 to 17-year-olds. So everyone can get their 2-dose series. Last week, the FDA and the CDC agreed that those 12 and up can and should indeed receive a booster. The booster dose is very effective at preventing severe illness or hospitalization or even death. So while we have seen some breakthrough cases and we have seen people who have had severe infections, those who are unvaccinated represent over 80% of the hospitalized patients or the deaths across the board, not only here, but that's a national trend. So we recommend the primary series for everyone age 5 and up, the booster for everyone age 12 and up. Those in the 5 to 11 age group are now eligible for a third dose. That one is restricted to those with moderate to severe immunocompromise. And we saw that with adult guidance back several months ago, where the third dose was introduced earlier and then the booster guidance came later. So if that trend holds, we may see the introduction of boosters for that age group coming later on. But remember that those kiddos only became eligible for vaccination in November. So your kids and mine only got their shots around Thanksgiving, and so they haven't been vaccinated that long. It's not quite time to be talking about boosters for that age group yet. But those with immunocompromise can receive a third dose 28 days after their second dose. And if you think your child is in that age group, the best recommendation is to talk with your child's physician or healthcare provider to determine if they are eligible or if they need that third dose.
Thanks, Dr. Hartledge. So while we're on vaccines, I'm going to bring in Dr. Burns, infectious disease physician at University of Louisville. Dr. Burns, what are you seeing in your patients right now, both in the clinic and in the hospital? And tell us, I know vaccine hesitancy, I know a lot of people have been slow to maybe get that booster or maybe even get their second dose or first dose. When you see patients in the hospital, like what are they telling you that maybe would have convinced them to have gotten that first, second, or third dose before they got to where they are?
Well, thank you, and thanks for having me. As Dr. Hartledge pointed out, the only good thing that may have come out of this Omicron variant spread is the fact that it has pushed more people, in my practice as well, to go ahead and get vaccinated. The boosters now, everybody that I've dealt with that are eligible for boosters, they get their boosters without much issue at all. But the biggest problem, of course, is the people who are still anti-vax, and they're still representing the largest amount of our population in the hospitals that I cover, as far as people who are admitted and people who are also in critical care units and on ventilators as well. So it's pretty reflective of what's going on in the general community, not only here but actually across the nation. So and the message, of course, is still, to if you're not vaccinated, get vaccinated, and if you're eligible for a booster, to get your booster as well too. So that's been my major message to my patients.
Thank you. Is there anything different symptom-wise that you're seeing right now with Omicron compared to Delta and other strains, or any other message you want to get out to the public?
No, just in general, pretty much viral type symptoms. You hear about things like the people having runny nose, cough, not feeling well, fatigue, loss of taste, loss of smell, those types of things. The problem though is when people try to self-diagnose themselves and they say, "I just have the flu," I can go on to work from there. And I keep telling everyone, if you have those symptoms, get tested. Let's find out what it is, because the symptoms are all so similar. Because if you actually do have COVID, you definitely do not want to be spreading that. You need to be quarantined, and then if you're tested and found out that you are positive, you need to be isolated. So that's pretty much the message that I've been telling my patients.
Oh, that's a great message. Want to make sure we're getting that out. I mean, COVID is more common than the flu right now. We are seeing both, but for either one, just really encouraging everyone to stay home if they have symptoms, so we're not spreading flu or COVID across our community, and then get tested so we can prove it and make sure that that's the case. So I'm Dr. Harledge. I know your Louvax mobile team's got some clinics planned. Do you mind giving us an update on what's going on this week with that?
Absolutely. So Catalina's going to pull up the calendar for us, but the Louvax community clinics do continue. We have a rotation of sites that we visit regularly, including Americana, Neighborhood House, Shawnee Arts and Cultural Center. And we also have some special events that we do in partnership with other groups like La Casita. And we do give all approved doses. So anyone age 5 and up can be vaccinated, and anyone 12 and up can get the booster dose from us as well. So we will specify on the website which product we have at which site, but generally we are doing a lot of our sites with Pfizer these days because it can include the largest number of patients, largest age group. So we are out there. Language services are available. There are many, many places to get vaccinated via our sites, but also retail pharmacies, doctor's offices, and things like that. Plenty of places out there, over 100 in the Jefferson County area, and encourage people to find one that's easy and convenient for you. The Louvax community clinics operate on a walk-in basis, but there are appointments available at many other clinics as well.
Thank you. Yeah, great reminder. While testing might be harder to find, there are plenty of vaccines available. And so please sign up to get vaccinated if you still are in need of either that booster, second, or first dose. There are appointments available today across our community. It's the #1 thing you can do to keep yourself out of the hospital. All right, I'm going to move on to testing. Catalina, you can keep showing all those sites there right now, but Dr. Harledge and Dr. Burns, there's been a lot of questions in the community about testing, especially about the different kinds of tests that are out there, rapid test, PCR. What's your thoughts on them? Which is it better? When do you recommend one over the other? Just help explain that to our community.
Sure. I'll be happy to start. For diagnosis purposes, that is, if someone wants to know, do I have Omicron or not, because or just or COVID in general, if I want to make sure if I'm infected, I don't know. The PCR test is the absolute test, the best test. That's the test that you want to have. If, say, for example, you want to make sure that you're negative or still not infected, or you're just doing something just to be safe, maybe you needed to join a group or to be with other people, sort of a confirmatory thing, again, just to make sure. Then in that case, the antigen test will work best for you under those situations. But by and large, though, people who don't know, people have the symptoms, but they're not sure exactly what it is. The PCR test is strongly recommended to tell if you have COVID or not. It's a much more reliable test, more so than the antigen test. But again, we're trying to establish a diagnosis. That's the better test to have.
So like Dr. Burns said, the PCR test is what we call the gold standard. It's the most accurate, but the big disadvantage to PCR is that it's not immediate. So turnaround times are at least 24 hours, and many clinics are now dealing with turnaround times of 72 hours or occasionally even longer because of the volume of testing that they're seeing. So the big advantage to the rapid antigen test is that it is immediate. It's done in 10 minutes. So you can administer those yourself at home. You can get one done in a healthcare facility or at some testing sites. Many schools are using them as screening tests. Many employers are using them as screening tests. So for that purpose, for asymptomatic people who are being screened regularly, antigen with an immediate result is the biggest deal. So like Dr. Burns said, if you're trying to know whether you can go visit your grandkids this weekend, antigen's a great choice. There's been a lot of talk about whether the antigen test is as reliable for the Omicron variant in particular. And so if you're using that COVID test, the antigen test at home, if you have symptoms, first of all, you should be at home. Even if you don't think they're COVID symptoms, please don't take those to work or school with you. But if you have symptoms and you test positive on the antigen test, you should consider yourself to have COVID. You can consider that to be a real, true positive test. If you need medical attention, go see your doctor. But the antigen test is very specific for COVID, meaning that you don't necessarily have to confirm your test with PCR. You don't have to go to a doctor's office to confirm that test if you don't need to be there for some other reason. If you have symptoms of COVID, but your antigen test at home is negative, you may want to consider repeating your test in a couple of days. We've found that it is less sensitive in the first couple of days of infection. Or if you have symptoms, you may want to seek PCR testing in a testing center or a doctor's office. So the Omicron variant has found our antigen test to be less sensitive, meaning that a negative may not be a true negative, but it is still very specific, meaning that if you have tested positive, you should believe that positive and believe that you have COVID.
Thank you both. I just wanted to highlight that last point is if your rapid test is negative, but you have symptoms or think you have COVID, that does not mean you can go out in the community like you don't have COVID. You need to either seek out that PCR test or stay home, stay isolated until you repeat that test 2 to 3 days later. We are seeing a lot of those tests being negative at first that do turn positive. We do not want you in the community spreading COVID to others. So I'm going to stick with the testing. We have a lot of questions in the chat, still more questions coming in. It's a really important tool to help us stop the spread of COVID because it tells you if you're positive and confirms that you need to stay home. Yesterday, Dr. Hartledge with the mayor announced one of the new testing sites in the community at Churchill Downs Orange parking lot. This is a partnership with Blue Water Diagnostic Labs. Yesterday, they provided over 1,200 tests, but does have capacity to do up to 5,000 a day. So there is still room for more people to sign up and go through that site. It is open 8 to 4:30, Monday through Saturday. They're requiring that you pre-register, so they have your information, and also bring your insurance card and ID. While this is a new site and has the capacity to serve a lot of people, just want to remind you that there are several testing sites throughout the community. And we have opportunities to get there's opportunities to get COVID testing wherever in your neighborhood and other places as well too. So Catalina, I don't know if you haven't yet, but you mind pulling up that testing webpage. So especially in our, there are 4 communities where our wastewater showed that our testing is not, we especially need more testing. And so these communities here really encourage you to get tested. There are sites in your community as well as at Churchill site. And then we also have partners that are able and willing to bring testing to your neighborhood. And so especially if you live in one of these 4 sites, if you know of a place that's willing to host a testing site, please let us know, and we will try to bring a testing partner to you as well too. Speaking of COVID testing, the wastewater, first, from our wastewater data, it's clear that COVID is everywhere. We are seeing levels 10 times higher than at the peak of the Delta wave in August. We know from the wastewater as well that Omicron has virtually replaced Delta and is now the main variant in our community sewage samples. When you look at the areas of the city with the lowest vaccination rates, they also have some of the highest wastewater levels of COVID and the highest number of infected people today. So in the slide with the communities listed, we are concerned that there's probably twice as many people positive that we know of that are testing positive. So right now our city is running 300 positive cases per 100,000 residents. That is about 3%. Doubling that means 6%, or 6 out of every 100 people in a room would test positive. That's 1 of every 15 people that you see today is positive for COVID. And so with that, that is why masks are so important right now. All of us are around COVID on a daily basis. If we are seeing 15 people, 1 of them are likely positive. Vaccines and boosters can provide protection to keep you out of the hospital. Testing lets you know to stay home and away from others, but the mask is what protects you from the 1 in 15 right now that may be infectious and probably out in the community that you could get COVID from. Just to add to this, why masks are so important is that modeling studies both on some of the national sites, so that if we could get our mask use in the community back up to 80% like we had last winter, we could be saving thousands of infections a week. That's thousands of people in Louisville that don't need to get sick, don't need to risk getting long COVID, or even just feeling miserable for a few weeks. Our hospitals are feeling the staffing shortage. This is just another really important reason to wear that mask, get your vaccine, get tested. All that are really important for like the next 2 to 3 weeks as we battle this current surge. I'm going to stop there. I know both Dr. Hartledge and Dr. Burns, a lot of people are feeling hopeless, just want it to be done. Well, what's your advice to people that are saying like, oh, well, I might as well just get Omicron now and be done with it? What would you say to those people?
Well, I know I've always been a glass half full person. I always will be. This pandemic, we can crush this pandemic, but we have to get almost everyone on the same page. I think the concept of herd immunity it's different for every disease. And I must admit, I did think initially, well, if we got to 80% of people being vaccinated, that should do it. But apparently, that's not going to be the case. It's probably upwards toward 90 and maybe a little bit beyond. So my number one, I'm extremely hopeful, and I think we can still defeat this. Number two, we've got to get people to do the things that are necessary. That is, getting vaccinated if you're unvaccinated, get it boosted if you're fully vaccinated, make sure you've gotten that. And number three, continue the thing that got us through this initially. That is the public health mitigating measures. That is masking, wash your hands, social distancing, also making sure you're in the area where there's good ventilation. I think if we can continue those things, and again, the difference maker is going to be the vaccination and the boosters. That's going to help tremendously. I still think that we can overcome this, and I think we will.
Yeah, I may not be a glass half full kind of person, but I would acknowledge that we are all tired. Certainly, Dr. Moyer and I are both JCPS parents. We're right there in it with you, doing NTI with our kids and trying to get everything else done at the same time. So I get it. I don't want to wear a mask anymore. I don't want to have to argue with my child to wear one when we go to Target. So I feel all of that. Our staff is tired. And I do agree though with Dr. Burns that continuing to get vaccinated, getting those boosters is the best path forward. We, like I said earlier, we talk about Omicron being mild. But I'm not sure that you want to roll those dice and count that you're going to be in the mild group. And even those who are relatively mild, who don't wind up requiring hospitalization or even medical attention, still feel really crummy for some time. So that's not an experience that anybody wants to have. And so getting those vaccines and those boosters for everyone who's eligible, which is everyone 12 and up now for boosters, that is our best offense. And then we continue to play defense as well, keeping our masks on when we're indoors, keeping away from crowds, and testing when we have an exposure or before we participate in an event or gathering.
Thanks for your insight. I just want to also add too that there are some really great treatments that are on the horizon that work really well that we don't have enough for everyone right now. And so anyone that can keep that mask, keep your social distancing, limit who you see to prevent getting COVID today, will have a much better chance of avoiding the healthcare system in a few months once those treatments are more widely available. So a lot of reasons to not get COVID today and to keep up all these COVID prevention measures. So really appreciate you guys holding on with us and not becoming one of the numbers. But we do know too, like if you are testing positive, as so many people are, please remember to call our helpline if you have any questions. 512-912-8598 also can help connect you to resources if you need help or need anything to stay home, stay isolated, stay quarantined, to protect your family and the rest of the community. So please call us if you have questions. That number is available 24 hours a day to help you out. Thank you, Kathy, for putting that in the chat. So with that, I'm going to end, and I know we have a ton of questions. I guess not end. I'm going to turn it over to Kathy to walk us through the questions.
Okay, thank you. Your first question is to Dr. Hartledge from Paul Miles of WHAS Radio. Dr. Hartledge, the 413 hospitalized on Monday is a record for the pandemic, correct? Is that correct? And do you know how many were admitted specifically for COVID-related illness?
Thanks, Paul. So first question is easy. The answer is yes. 413 hospitalized patients is a record. The previous record was 399 in December of 2020. So this is our first time over 400. That does include all ages. That includes all hospitals. So it includes the U of L system, Baptist system, and Norton Healthcare system. Your second question, there's a lot of talk out there about admitted for COVID versus admitted with COVID. And we kind of have three categories here. So you can have a COVID admission, which is the run of the mill, like I have COVID, I'm short of breath, and I need treatment for this virus. Then we have a second category, that's a direct COVID admission. So the second category I would call an indirect COVID admission. And that's people who have chronic conditions that are exacerbated or destabilized by their having the COVID infection. So maybe somebody with type 1 diabetes who winds up with diabetic ketoacidosis or uncontrolled diabetes because of the presence of their infection. So they're not being necessarily admitted for respiratory COVID symptoms, but they're being admitted for something that they would not have had in the absence of the virus. And then we do have those incidental COVID admissions. So that's your, young guy who's had a motorcycle accident, admitted for unrelated trauma, and finds out incidentally on screening tests that they have COVID. The hospitals will have to give you the numbers for those. They are screening admits, so there certainly are going to be a number of those admitted with COVID versus admitted for COVID. And I'll ask Dr. Burns to comment on what he's seeing in the hospital. But my belief is that the significant majority of those inpatients with COVID are either admitted directly for COVID or indirectly for an exacerbated condition that they already have.
And that is exactly correct. We're seeing the same things at the hospitals that I cover as well. You have people that are admitted directly for COVID. That is, those people who their oxygen saturations are low. They are having problems breathing. They may be obtunded. They have other symptoms that make them dangerously low oxygen levels, such that they need immediate and emergent medical care. And we also have people who are being admitted for appendicitis, people who are being admitted for cholangitis, gallbladder attacks, people that come in with maybe diabetic foot ulcers, and on screening they are COVID positive. And so the question is, what to do about them. But those people those folks are being admitted too. So we're seeing the whole spectrum as well, admitted for COVID, and as you said, admitted with COVID.
Okay, great. Thank you both. This next question is from Heather Fontaine with WHAS TV News. Good morning. Can you talk about complaints you've received questioning the legitimacy of some of the pop-up testing sites, specifically one operated by O'Hare Labs? How long are people waiting for their results? Have you been able to contact them? What kind of approval process is there to open a testing site? Dr. Moyer, can you answer that?
Sure, I'll start, and then I'm going to hand it over to Nick on my team to finish. So we have been getting complaints about O'Hare Labs, probably about a dozen at least. The main theme is that they do the testing, but then don't provide results in a timely manner. For one person, it's been 11 days, for others 5 to 6. But they've not been responding to repeat attempts for us to contact them. So I encourage everyone who is looking for testing to please use the providers listed on our website. All of those have been vetted by us and are getting results in a timely manner. So please check out our webpage for testing locations and use those when you're looking for a test. Nick, anything else to add?
So I will say that LMPHW does not license medical providers or laboratories. And so the state does have a division of laboratory services where they conduct CLIA certifications and certifications on lab and testing services. Also, the Board of Medicine does the licensing for medical providers. So we will help facilitate investigation of complaints and assist the Board of Medicine as well as laboratory services in investigating these. We'll also say that any entity offering laboratory or diagnostic services also has to register with Team Kentucky and the Department of Public Health, and those forms are available on Team Kentucky's website. So we are trying to investigate these, hand over what information we have to the state so that we can get it into the right authorities to address this issue.
Okay, thank you both. And then Heather had a follow-up question. Should people be using caution when choosing which site to get tested? And I think, Dr. Moyer, you answered that by encouraging people to use the testing providers that we have provided on our webpage because we have vetted those. Let's see. Our next question is from Sarah Ladd. We've had some, with the Courier Journal, we've had some questions about how long a person will continue to test positive for COVID-19 after contracting it and quarantining. Can one of the doctors walk through the timeline of being contagious and testing positive? Dr. Burns, you want to take that? when is someone contagious and how long can they test positive?
Sure. Yeah, I'll be happy to. We generally say that people are going to be contagious usually a couple days before they're symptomatic and about 3 days after they're symptomatic. That's when they're the most contagious. And again, that's provided you have symptoms because there's still asymptomatic spread as well too. That is people who never have symptoms, but they still pretty much in this sort of 5 day window, if you will, can still be somewhat contagious. I've seen as far as tests remaining positive, I've seen some people go up to like 2 and 3 months still having positive tests, but be totally that is they've gotten over their COVID and they're not really symptomatic at all. So, someone who has actually gone through COVID but still continues to test positive, because of that, it's really testing to sort of release somebody out of isolation or testing to let them go back to work is not necessarily the best idea. I think we should do it more on a time frame, not necessarily the fact they have to be negative before they go back. Again, simply because they can remain positive for up to 3 months.
Okay, thank you very
And
much.
there, Kathy, I'll just add in there. I mean, that's the reasoning behind the CDC's changing guidance from 10 down to 5 if you can wear a well-fitting mask on days 6 through 10. And so, because you're most contagious before you test positive, and then like in that first 3 days, 5 days can be okay if you can wear a mask. Probably, I think in their background document, 30% of people can be contagious after day 5, like in those days 5 through 10. So that mask is very important if people choose to follow the 5 day isolation instead of 10.
Okay, thank you, Dr. Moyer. There's a follow-up question from Sarah. What trends are we still seeing as far as who is still not vaccinated? Looking at the dashboard, it seems to still lean towards younger and male. But Dr. Hartledge, could you maybe share some trends you're seeing and possible reasons?
Sure. So Sarah, you are correct. We do see, I would say, our younger male demographic is the least vaccinated. A couple things I would first distinguish between those who have reduced access to the vaccine versus those who have chosen not to get vaccinated. So, for example, we hold events that focus on our new immigrant population, those who have limited English proficiency, things like that, who don't have significant interactions with the healthcare system. That is one of the goals of the LUVAX community clinics, is to serve those patients in particular. We also, of course, have those who have plenty of access to the vaccine, but have chosen not to get vaccinated. In many cases, what we're hearing is people who either don't believe that it's safe, people who have concerns about the long-term safety of the vaccine. To those people, I would say that billions and billions of doses have been given worldwide, and that this is among the safest medical interventions that mankind has ever come up with, and perhaps the most well-studied drug in the history of mankind, given the focus on the data. And then the other group is those who say that they don't believe that they need a vaccine because they don't believe that they would be at risk for severe infection. And that group in particular, I think, skews toward young and male folks who believe that they are young and fit and will not have a severe infection. They won't need to go to the hospital. To those people, I would say, even if you don't need to go to the hospital, you're still going to feel pretty crummy. And I'm not sure that I would want to sign up for that. But also, we have some evidence to suggest that, some people, even without chronic conditions, can wind up with severe infections, and we don't always know exactly why. So you're certainly rolling the dice by choosing intentionally to not get vaccinated. I'll ask Dr. Burns to comment on what he's seen out in the community as well.
No, I agree 100%, and that's exactly what I see. And we try also to emphasize to especially to the young people that yes, odds are you probably will not become as ill as someone who may be older or may have an immunocompromising condition. However, the problem is you may be fine, but you can actually inadvertently spread it to someone. So and most people, most of the young people, they still have their their parents or their grandparents that they still associate with, and in most all cases they have some other type of chronic illness associated with them, and again that puts them at a higher risk for a possible bad outcome should they acquire COVID. So we try to emphasize that to the young people. Think not so much about yourselves, but think about other people around you. Or if someone is like really young, like under the age of 5, that is not even eligible for a vaccine just yet. So we try to hit those points as well, and not so much concentrating on how they would feel or how they would do.
Okay, thank you both. This next question is from April Rickert with WFPL. Do you have numbers on how many people were tested yesterday at the Churchill Downs site, and if there are still appointments available this week? How quickly were people able to move through? And Dr. Hartledge, I know you were there yesterday. What were your observations of seeing people move through? And I believe earlier, Dr. Moyer, did you share that there were 1,265 people tested yesterday? But Dr. Hartledge, what did you observe while you were there?
Yeah, first thing in the morning yesterday, they had about 100 cars in line when we were on site. They were running pretty efficiently, especially considering it was the first day, and there are always some growing pains when you go live with something like that, things you can't anticipate ahead of time. I believe that they were getting folks through in about 30 to 45 minutes. And I would say that is a great efficiency. And even if it takes a little bit longer than that, let's say you spend an hour there, that is still much faster than if you are visiting one of our local urgent cares or certainly emergency rooms where waits have been several hours between the number of patients there that need treatment and then those who need testing on a less urgent basis. So I think that's it's going to be more enjoyable for both you and the healthcare system. If you seek your testing at a testing site, it'll be faster for you, and it clears up that chair or that bed for the urgent care or emergency room to use for someone who may have a higher need.
Thank you. And I believe, did they share yesterday that they can test up to 3,000 or more a day? So we don't anticipate that there are any trouble with getting appointments, maybe on a particular day, but they should have plenty of capacity. Is that not correct, Dr. Hartledge?
Yeah, they quoted about 5,000, and they have online sign up, so they should, I believe, should have capacity for this week.
Thank you. Dr. Moyer, April has a follow-up question, and this is in response to some remarks you made earlier. She says, to clarify, is the roughly 3% of all Jefferson County residents having tested positive since the start of the pandemic? Or do you mean currently with our current situation?
That would be since the start of 22. So if we have 300 per 100,000, 300 cases per 100,000 in the last week, if you do the math, that is about 3% of all Jefferson County in the last week tested positive. And then to follow up with that, from our wastewater and our test positivity, we know there are people that we are missing that are not testing positive. And so we think it's at least double that, which would be 6%, which is about 1 in 15 people currently testing positive. So 1 in 15 should be in isolation. Right now, we know that that is not happening. So just assume that 1 in 15 people you see out if you're out in public has COVID, which is why that mask and those spacing and limiting your interactions with people is so important right now.
Okay, thank you. And Paul, I think we also answered your last question of how many were tested at Churchill Downs yesterday. I have one question from social media, Dr. Moyer or Dr. Hartledge, can you address how we are ensuring testing and vaccinations for the homeless population? Dr. Hartledge, you want to start?
Absolutely. Is this Tara on Facebook? We've had this conversation before. I'll say in the earliest days of the pandemic, we started trying to protect the homeless by protecting those who serve them. So one of the very early groups that was vaccinated, that we provided testing for, was shelter workers and healthcare workers who help treat those in the houseless population. We have since done a number of events for vaccination for the houseless population. They are available through Family Health Center's Phoenix Healthcare Center for the homeless. We have also taken them to shelters and to encampments on a number of occasions, including Wayside, VOA, and some encampments. We have offered boosters to this community for obvious reasons. It's not always easy to seek them out in terms of, your doctor's office may be able to call you and say, you got your vaccine 6 months ago, it's time for you to get your booster. And it may be difficult to target the houseless population in that way. So the initial uptake of boosters is a little slower, but we do offer those to without question to that population. And as you know, we do not have identity or verification or demographic or financial requirements. So we try to make it as easy as possible for people to get vaccinated. We also offer testing through our partnership with the Kentucky Nurses Association on a regular basis in shelters, and then in more targeted areas when we know that there are positives or outbreaks in those facilities or settings.
Okay, thank you. That was the last of our questions. Dr. Moyer, I'll turn it back over to you for final comments.
Thanks, Kathy. So yeah, hang in there. There is a lot of hope, like we talked about here. If you haven't gotten vaccinated or boosted, today's the day, and wear your mask. Please stay safe. A lot of COVID out there. And we'll be back next week to talk to you more.